So in tertiary prevention, this is the thing we have to keep in mind, that is a disease may occur, impairment will be coming, disability will be occur, and finally the patient may ends up with handicap. These are the areas we have to focus and provide the rehabilitative measures. Okay. Now, cancer rehabilitation. Cancer rehabilitation can be broadly defined as the maximum restoration of physical, psychological, social, vocational, recreational, and economic functions within the limits imposed by the malignancy and its treatment. So, cancer have already taken place. The patient is a cancer patient. So, lot of treatment have been done to that patient. So, patient is having several disabilities, limitations, etc. By standing within that limitation, we are motivating and we are providing more assistance to such patients in order to come back to the normal life as much as possible. These measures include in the cancer rehabilitation. So there are four types of cancer rehabilitation: preventive rehabilitation, restorative rehabilitation, supportive as well as palliative rehabilitation. So preventive rehabilitation include, this will be started in the early after the diagnosis of cancer. Immediately after the diagnosis of cancer, we will be start with the preventive rehabilitation. Okay, so immediately after any surgery or radiotherapy, chemotherapy, here we will be providing the preventive rehabilitation therapy. And in this stage, no significant physical impairment will be there for the patient, but the treatment must be started. Okay. So the next one is restorative rehabilitation therapy. So here it will be directed at the comprehensive restoration of maximum function for patients considered cured or controlled. That is, after a cure or control of the disease only, we will be starting with the restorative rehabilitation. Now, supportive rehabilitation therapy. Here, attempts to increase the self-care skills and mobility of the cancer patients with growing cancer and progressive impairment and disability by the application of quick, effective methods. So here the patient is having several problems associated with cancer, and beyond that we are attempting or we are trying to increase their self-care abilities and the mobility, etc. by the patient by all. Okay. Now we are having palliative rehabilitation therapy. This aims to increase or maintain the comfort and function of patients with terminal cancer by utilizing physical modalities, simple orthotic devices, and assistive equipment to manage pain, joint contractures, and pressure sores. So here, palliative rehabilitation therapy include, this is done at the last stage of a person's cancer patient's life. Okay. So here the only aim of a healthcare practitioner is to control the signs and symptoms only. Nothing more we can do here. Okay. So terminal cancer stage, we will be providing the palliative rehabilitation therapy. These are the four type of cancer rehabilitation. Now in cancer rehabilitation, an interdisciplinary team is being included. Like a lot of people are involved in this group or in this team. That is physician, speech language pathologist. That is after an laryngeal cancer and all. Then rehabilitation nurse is the social worker, physical therapist, psychologist, occupational therapist, chaplain. Chaplain means spiritual person. Okay. Then vocational counselor, nutritionist, recreational therapist. Everyone is being included in cancer rehabilitation. So this is including the interdisciplinary cancer rehabilitation team. So here each member is having their own work of area and works to do and all. Okay. So herewith we have completed our prevention, detection, screening, and warning signs of cancer. Okay. So you have to keeping in mind from our first part, that is prevention is there, levels of prevention is there. In the primary prevention means it include health promotion and prevention, specific protection. So that we have to keeping in mind. And here we have studied regarding the warning signs. Then only we could able to find out the early stage of the cancer. After this, we have seen the secondary prevention. That include early diagnosis and treatment. So cancer screening is there. The methods we have seen, American Cancer Society's recommendations we have done in screening. Then tertiary prevention. So here disability limitation rehabilitation is the coming. and cancer rehabilitation we have seen, its types we have seen, then the people included in that is interdisciplinary cancer rehabilitation team. Okay, so herewith we are completing our second part, prevention and all. So any doubt you can ask me. It's very rough area, I know, but you have to read textbook also after coming to college. Then you will get more idea, and we will be having more discussions on this topic in live classes. Okay. So thank you. Okay.